Hi guys, welcome to Fighting Multiple Sclerosis. Today I am going to discuss about the treatment of multiple sclerosis. Now a lot of research is going on in the management protocols, in the treatment, in the cure for multiple sclerosis, and there are a lot of things, upcoming things which are coming up. But essentially, at the current point of time, if we see, there are four main treatment modalities for multiple sclerosis. I'll take you quickly through all four of them. The first one is the disease modifying drugs. Disease modifying drugs are the drugs which tend to attack or tend to work on the progression of the disease. So they work on the immune system, they tend to have a calming effect on the immune system, and in the long term are likely to reduce the progression of the disability by around 1/3 or so. So a variety of disease modifying drugs are available, like interferons called Avonex, glatiramer acetate, Copaxone. Names are different in different countries. Fingolimod is available, natalizumab is available. Then oral disease modifying drugs like fumarate, dimethyl fumarate has come up. So this is about the disease modifying drugs. They tend to reduce the disability in the long run. Then the second part of the treatment is the symptomatic treatment. So by symptomatic treatment, I mean the drugs which work on our specific complaints. Now, if you have spasticity, there is baclofen for spasticity, there is tingling, numbness, and neurological pain. So there is gabapentin for that. There are antidepressants for depression, painkillers for musculoskeletal pain. So these are the symptomatic drugs. Then most important of all, there are steroids. Methylprednisolone, high dose methylprednisolone is used for relapses. So it acts on the inflammation of the nerves and stops the inflammation, reduces the inflammation at that point of time, and helps in the reversal of relapses. So these are the basically drugs or modalities which are symptomatic in nature. The third and fourth ones are, I believe, very important yet often neglected. Now the third part of the treatment is exercise. You can call it physiotherapy, you can call it workouts, but exercise is very important. It is probably the strongest antidepressant. It is probably the strongest modality against fatigue. It helps you in regaining some of the lost strength. It helps in prevention of muscle atrophy, some of the functional loss you are going to happen in due course of what is going to happen in due course of time. So if you work specifically on that, you are likely to again reduce the progression. So exercise is one very underappreciated yet very important modality in the treatment of multiple sclerosis. And then there is nutrition, there is diet. So diet, nutrition, antioxidants, they also help to some extent in nerve renervation, specifically high fat diets which are low in carbs. So they are anti-inflammatory diets, though they might help in reversal of the disease, as has been shown by a couple of authors. And definitely they help in reducing the speed of progression and also halting the speed of progression. So I think we all take drugs, disease modifying drugs and symptomatic drugs based on recommendations of our neurologist. But the point I would like to make over here is we also need to focus on exercise. We also need to focus on our nutrition. We also need to focus on some of the supplements which are useful, specifically like vitamin D, which has been shown to be very useful in cases of multiple sclerosis. So yes, these are the 4 points I wanted to make. So that's all for now. Stay tuned, guys. Have fun, work out, eat well, sleep well, enjoy. Cheers.